want to say hello to everyone and welcome. It's really good to see everybody this evening, and welcome to FNU's virtual event for Empower 2021, celebrating National Midwifery Week. So tonight, Dr. Jeneen Lomax and I are going to be your host, and we are also joined by Lip and a few other folks from Frontier. So thank you all for being here. And we're going to talk a little bit about just Frontier and our community and how you can be a part of the culture of caring that we have at our Frontier, in our Frontier community. So let me just back up and say really quickly that I am Eileen Thrower, as you can read on the screen, and I am the interim department chair for the Department of Midwifery and Women's Health. And Dr. Lomax, would you like to introduce yourself?
Of course. I am Dr. Jeneen Lomax. I am the clinical transition coordinator for the CNIP and Women's Health program. So what that essentially means is that I oversee all of the courses, the clinical courses, before you all transition until your practicum. So you will spend a lot of time with me, and we will have a lot of fun together if you join us here at Frontier.
And Dr. Lomax just happens to be on campus this week.
Yes.
Is in the middle of a clinical bound week, which we're going to talk about a little bit as we move along. So you'll get to hear more about that. But she may have to leave us early because she's in the middle of a very busy week of exciting activities. So.
Yes.
So the first thing that I want to say about Frontier is that Frontier really has a mission that that really resonates with me, that I have a lot of value, place a lot of personal value in this mission. You can read it on the screen: to provide accessible nurse midwifery and nurse practitioner education, to prepare competent, entrepreneurial, ethical, and compassionate leaders in primary care, serving individuals with an emphasis on women and families in diverse, rural, and underserved populations. I always say when I'm introducing myself at our orientation sessions, I always like to mention that I personally don't have any degrees from Frontier. I did my midwifery and my doctoral degree somewhere else. But when I decided to transition into a role as an educator, it was really because I wanted to contribute towards the midwifery and women's health professions by making more midwives and women's health nurse practitioners. And so I did the thing that you would do. I went online and read the mission and philosophy of institutions that I was thinking I might want to consider working at, and really found myself at Frontier because of the way that my mission really aligns with Frontier's. And I think that you'll find that to be broadly true among the faculty here. So I like to say that I'm here sort of like the in-laws, the old in-law saying, I'm here by choice, not by, I didn't just accidentally end up here. Really chose to be here and have loved every minute of it.
Okay, so at Frontier, we have distance education, and I know a lot of times students can really be worried about feeling that sense of community here, or even the rigor of the courses and feeling like they have that social support. And we really want you all to know that we absolutely believe in culture of caring. And so all of the faculty here are dedicated to really mentoring, caring for you all, and spending a lot of time with you all, regardless that it's distant education. And you're going to use your community as your classroom. And although you can be at home with all of your studies, you get opportunities to come and travel to campus to see our brand new, beautiful campus that I know you all will love. I am having an amazing time while I'm here. But you'll come here and you'll experience Frontier Bound as we get you all prepared, for your educational experience at Frontier. And then you will return again for Clinical Bound. And what Clinical Bound is, it's a skills intensive. And that's what my students are experiencing right now. So after you have finished all of your didactic courses, and you're ready to venture off into your clinical practicum, you come and you spend 1 week with me and my clinical bound faculty, and we teach you all kind of exciting skills. You will deliver babies, catch babies. Midwives don't deliver babies, we catch babies. We attend to births. You will learn how to suture, contraception, placing IUDs, like so many different things. It is a really action-packed week, and it is quite intensive, but you might come to clinical bound a little nervous and a little apprehensive to start your clinicals, but once you leave here on Friday, you are much more prepared and you're far more confident. So it's a really exciting time, and we like to have fun and celebrate all of your accomplishments.
Speaking of accomplishments, the other thing that's really exciting about Frontier is that we have a really robust faculty. They're among the faculty, within the Frontier, you're going to find that we have 80 years of experience as an education program, so that's really exciting. We have students and alumni in every state and really in many places around the world. Currently, we have about 2,500 students enrolled and over 8,000 graduates. So we have a lot going on. And the thing that I love about, one of the things that I love about Frontier is that all of this, all of these years of experience, all of the faculty, the graduates, the current students, they're all becoming advanced practice nurses. So we're really all on the same page. And I think that one of the things that many people notice when they come, or people say is, wow, I have found my people here, because we are all very like-minded and on a mission to become advanced practice nurse leaders in healthcare. So I've already introduced myself, and Dr. Lomax has introduced herself. Do you want to talk about some of the other folks that students might come across, Dr. Lomax?
Yes. So while you're here, although you are at, the comfort of your home, you still have a great deal of support. And so with all of our courses at Frontier, we have course coordinators. And those course coordinators, they oversee that particular course. And then you will also have course faculty. So a lot of times students are used to, when they're taking college courses, it's just one professor for that course. The beauty about Frontier, and this was something that was very different for me, is that you're actually teaching in a course with a group of faculty. So you will get to learn from different experiences, varying degrees of expertise. And that's something that is really great about our courses here at Frontier. And also, when it's time for you all to start to get ready for your practicum, your clinicals, you have a regional clinical faculty, and they walk you hand in hand. They walk you through all of the processes. They help you figure out all of your clinical placements, the documents that you need, and how to get yourself prepared for that. But as equally as important and very, very beneficial to you all is the academic advisors and the clinical advisors, because they help you make those decisions, and they work with you, letting you know what you are, what courses you're able to move forward to, or like any type of holds or anything like that you have going on. They help to work with you. And as any other institution, we have financial aid officers if you need financial aid to pay for your education. And we also have the credentialing coordinator, and the credentialing coordinator you all will get to know very well, because as you're finding your clinical sites and you're going through all of the paperwork and getting everything in order so you can begin your clinical journey, you will work hand in hand with the credentialing coordinator. So you have a lot of support here. You're not out here on your own trying to figure it out on your own. We believe in a culture of caring, and we all work with you to make sure that you have everything you need to get started on your journey.
So just to go into a little more detail about this team of people that you would have working with you at Frontier. Dr. Lomax already mentioned quite a few of these people. Carissa Lippett, that is with us tonight, is one of our clinical advisors. We really have a team put together to help support you as you move through your academic courses and as you move into your the clinical setting. We also have a culture that really encourages a sense of social presence so that you get to know each other. We really encourage you to reach out to each other and have study buddies or small groups of students working together. We have a full range of financial aid services and really quite a lot of scholarship opportunities available. We have a full library, even though I think that sounds a little bit counterintuitive since we don't spend much time on campus. We do have a physical library on campus, but really what we have is a digital library, and that allows you access to an enormous amount of resources. And we also have a diversity impact program that we're really proud of. Diversity, inclusion, equity, belonging are all concepts that are front and center for us at Frontier. We acknowledge that we have come a long way, but we have a long way to go, and we are still working very hard and very diligently to make that work front and center for all of us as we continue to move forward on that journey. All in all, I think that the support that you will find at Frontier is really unparalleled. In my experience, I have many students that say, I've heard many students say they feel like they have more support and more connection in this distance program than they have in any of their other schools they went to that were actually a brick and mortar kind of school. So, and I think a lot of it is because we know that we're all over the country. We're very intentional about trying to stay connected and form that community.
Yes. And you want to go, Eileen?
No, go ahead, please.
Oh, okay. And, for students, when we think about student support, we definitely have to mention diversity, equity, and inclusion, because I think it's imperative that you are part of a university that is committed to diversity. And as a faculty of color and a midwife of color, that is important to me. And I am extremely proud of the work that Frontier Nursing University is doing and their commitment to making sure that our university is diverse. We have equity and we are inclusive of all. And I think that you will feel that and you will see that if you come to Frontier, and we're hoping that you do. And you can see that by the faculty, by the staff, and the student body. And as Dr. Thrower said, we might still have a long way to go, because that's in this world in general, but you will definitely be able to palpate the effort that we are making. And it just makes me proud to be a part of this university. And so we want our students to know that they have that support and they are in a safe space, and everyone will feel like they are included here.
All right, so we kind of like this little graphic. We're all sitting, you're all sitting where you are currently, and we have these goals ahead of us. And the last couple of years, I think, has taught all of us that really what our plans look like are really more on the bottom. The universe has lots of obstacles and challenges that we keep encountering on a daily basis these days. But I will tell you that we are always amazed at Frontier, the resilience of our students, the amazing commitment that people bring to this program. And what I love, one of the things I love about the role that I'm in as the department chair is I get an email notification every time a student graduates. We have students that graduate basically every day of the year.
Every day.
Once you've finished all of the requirements, you'll get an email saying, congratulations, you've completed all your requirements and you are now a graduate. Your diploma's in the mail, and that takes a little longer. But I get those emails almost every single day. And that really is a testimony to how resilient our students are, and how I think that we've put a program together at Frontier that really works. And if you trust the program and you just go with it, you will reach that goal.
Can I speak to that a little bit, Eileen, real quick?
Please do.
And you know, and that what I like a lot about that picture that you just saw is that we always have this plan in mind. You all have this goal, right? And you see the finish line, but we want you to also be extremely flexible. This academic program, although it will be fun because you have this passion to become a midwife, it's very rigorous. And so midwifery in general is about being flexible and about being able to overcome a lot of the obstacles. So you may have your goal in mind, you may have your plan, but your plan may change. And we want you to know that if your plan changes, that is okay. You know, there are valleys and there are hills or whatever, but you all will definitely get to the finish line. So just be flexible and stay committed.
Do you want me to take this one, Jeneen, or do you want to go?
Yes.
Okay.
Go ahead.
So we have a couple of different options for you if you're considering midwifery or women's health. The first is the Masters of Science in Nursing program, and that would be for people that are already nurses and have that BSN degree, but have not yet pursued getting a master's or an advanced practice nursing role. And then the other is the postgraduate certificate. So this is for people who are already advanced practice nurses. So we frequently will have, for instance, maybe a family nurse practitioner decide that they want to or come back and add midwifery. We'll sometimes have, although I've also had family nurse practitioners come back and add the women's health nurse practitioner. The postgraduate certificate does not give you another MSN, but it does allow you to be on that path for certification and to add that to your practice. It is a little bit shorter program than the MSN, of course. We also have the Doctor of Nursing Practice, which it's a direct admission process. If you start off with the MSN program, you can go seamlessly straight through to the DNP. Although some students will also choose to opt out and do that at a later date. So in terms of the time frame options or how long is this going to take me, if that's what you're wondering, here's the answer to that question. We work on a term system, so we have 4 terms a year, so it's sort of similar to a quarter system. Each one of our terms is 11 weeks, and then there's a 2-week break between the terms. So for the MSN program, that is going to take somewhere between 2 to 3 years, depending on whether you're really pursuing this as a full-time endeavor or a part-time endeavor. If you're in that postgraduate certificate, that's about 1 year to 1.5 years, again, depending on how much time you have to devote to your studies. And then the Doctorate of Nursing Practice, once you finish that master's degree, is done typically in about 15 to 18 months.
Okay, so admission criteria into our MSN program, you must be an RN with a current and active license, have a bachelor's degree in any field, a minimum cumulative GPA of 3.0 in your highest nursing degree earned. So if you've already earned a master's or bachelor, whatever, it has to be 3.0 cumulative GPA. You must be in good academic standing in prior educational work and at least 1 year of RN experience.
So if you are a postgraduate student that already has that MSN and already an advanced practice nurse, the criteria is really quite similar. You have to be an RN with your active license, that same 3.0 cumulative GPA, and you've got to be an advanced practice nurse in one of the specialties that you see here on the screen. So it's really a fairly inclusive list. If you're already in one of these advanced practice roles, then you would be welcome to apply to come back to get a different degree, whether that is the midwifery, women's health, etc.
And so at Frontier Nursing University, you are going to surround yourself with those that really have the same passion, the same determination, and the same desire to take care of patients, gynecologic and obstetric patients throughout the lifespan. So those people are on the same exact mission with you as you. So come on to Frontier Nursing University and join us. You will have an amazing time. Like Eileen said, you will be with your people.
All right, so here are some important dates that you might want to make note of. October the 20th is the deadline to apply to start coursework in April of next year. And then if you didn't quite make the date of October 20th, obviously that's coming up rather quickly, then the next time to apply, we have 4 application cycles per year. So the next application cycle deadline would be January the 19th, and that would be to be able to begin coursework in the summer of 2022, July of 2022. So steps for application, you would go online to the FNU website. There's an online application. It does require writing a couple of essays. You'll have to upload your resume. You'll have to have references, at least 3 professional references, a copy of your transcripts from your bachelor's degree program. And then there is a portfolio option that offers some limited possibilities for non-BSN candidates. There is, you can see the tuition rate there at the bottom of the screen, and those rates are updated on the website regularly, whatever that would change.
And so after you complete your didactic courses, you will begin your clinical experience. And that might be different from other universities that you might do your clinical courses and your didactic courses simultaneously. But here you will complete all of your didactic courses, and then you will be able to focus your attention to that clinical experience. So for the MSN program, you must complete 675 clinical hours and a minimum of 16 weeks of clinical experience. And our PGC students, since you are already advanced practice nurses, your clinical hours are 540 hours and a minimum of 14 weeks of clinical experience. And the companion DMP will require an additional 360 clinical hours. But it's not just about hours, it's also about different type of patient encounters. And when I say patient encounters, I mean, how many is a certain number of births that you must attend, a certain number of postpartum visits, a certain number of well-gynae visits, and so forth. So you will have a list of all of the requirements, and you will be able to work through all of those clinical hours and all of those patient encounters through a series of 5 clinical courses.
So we're going to flip through the rest of these slides, and then we'll take questions at the end. How about that? Here's some pictures of our new campus, which we're really excited about. It's officially opened as of 3 days ago on Monday. We have our first full enclave of students on campus this week, and so we're really excited about that. It's a very beautiful, comfortable place. So I am going to let's see this is a slide that I love. A midwife must possess the hand of a lady, the eyes of a hawk, and the heart of a lion. So let me stop sharing our slides though and see if anyone has questions. You're more than welcome to put questions in the chat box or just turn your microphone on and ask if you would like to. We have, beside Dr. Lomax and myself, we've got some other faculty and staff here with us that can help answer your questions.
If we decide to go through the post-certificate program, is there a way to do the DMP after that?
Yes, there certainly is. You can, I don't know if anybody else wants to handle that question, Carissa or Susan or anybody want to take that one?
Yes, you can. You would still do the direct entry DMP application, and you have until the last day you're enrolled to go on through, but you would still have to reapply for the DMP.
All right, there's a question in the chat box. Thank you, Susan. So the question in the chat box, can we pursue a DMP in another area like nurse education? Currently, our DMP program is just a clinical program. So it is a clinical, the DNP project has to be in a clinical setting. So not right now, we do not have a track that would really allow you to do that in nursing education. That is something we talk about from time to time. So think that may be changing, but at this moment it is not. It's a quality improvement project that is done within a clinical practice site. All right, Heather, this is a really good question. How much labor and delivery experience do you think is needed prior to starting the CNM program? The answer to that question is none. So you do not have to have labor and delivery experience. You have to have some nursing experience, but not labor and delivery. And there is just a lot of support for the idea that it's not required. It's a little bit different learning path if you have labor and delivery experience versus if you do not. But in the end, you all end up you end up at the same place, and it works perfectly well. I will tell you that whatever your experience is that you bring with you to the table, I think you'll find it helpful. You'll find advantages if you currently work in the emergency department. There's going to be you're going to bring an awful lot with you to the table. Things that somebody that was only in labor and delivery would not be bringing, right? If you're a med-surg nurse, if you are a doula, if you are working in ICU, if you are working in an outpatient setting, all of those, we get so focused, or when you think about midwifery, you think about labor and delivery. But please know that midwives spend a lot of their time in the office and outside of that labor and delivery unit. So if you know something about labor and delivery, you may not know you may know much less about the outpatient setting. So you're going to bring a lot of things with you no matter where you come from, and labor and delivery experience really is not a prerequisite. Sometimes if you've been a labor and delivery nurse for a long time, the challenge is unlearning some of the things that you thought you knew. So it works in either case.
Thank you for saying that. I've had a lot of people say that they have been having a hard time finding a job as a CNM if they didn't have labor and delivery experience in particular, because some of the jobs that are posted require a certain amount of years in labor and delivery in addition to the CNM certificate. So you're finding that that's not really happening. As long as you have some kind of nursing experience before, then you'll be fine.
Yes, Heather, I truly believe that you will be fine.
Thank you.
Yes. Jeneen, did you have labor and delivery experience before you became a midwife?
I did have labor and delivery experience, but I know several midwives that had zero labor and delivery experience, and they were phenomenal midwives. So I do not think that makes a difference. And right now, during Clinical Bound, I have several students that came to Clinical Bound terrified, and worried because they didn't have any labor and delivery experience and they did not think that they were going to excel here while they were at clinical bound. And I cannot tell the difference between our skilled labor and delivery nurses and our nurses that do not have any labor and delivery experience. But to speak to organizations not hiring you if you do not have labor and delivery experience, what I am seeing is that a lot of students transition to labor and delivery during their CNM education to gain some experience before they finish the program. So that's an option to you. But what I think is a well-rounded individual is more important.
Yeah, thank you.
I really agree with that. And to Angela's question is it hard to transition to the CNM role if you have no previous experience in labor and delivery?
Oh, that way.
I'm going to say that really and truly in terms of that role transition, it may almost, it's not necessarily easier with labor and delivery experience. In fact, sometimes it can be more challenging when you've been in labor and delivery as a nurse to transition into that different role. It's going to be different. It's not, I don't think one is better or worse. I just think it's different. So I really hope that we're able to put that concern, allay that concern a little bit, because I don't think it's a really significant issue. All right, Kimberly has been a CPM LM for the last 15 years. Can you speak more on the non-BSN portfolio access? I don't know, Susan, do you feel comfortable commenting on that one, or do you want me to try to take it?
Well, I'm trying to find the question so that I can read it.
Yeah, it's from Kimberly McGinnis.
I'm not seeing it.
So Kimberly, it says,
I see.
You got it now? Okay.
Unfortunately, the CPM and the LM does not count. When I say that, what they're looking for is the ADN and then a bachelor's in another field. So you can't transfer any of the CPM into Frontier.
So Kimberly, do you have a bachelor's in another field? Because that would go ahead.
Yeah, so I don't. I'm currently in an ADN program right now. And I was planning on right after that, just transitioning right into a BSN program. But I had heard you mention briefly just about that portfolio option. So, and I had never heard of it before. So I just was wondering what the details were, if there was anything that was potentially applicable to me, because I'm 40 coming back to school. And, if there's any ways I can cut down on some of the time between now and being able to actually apply once I have my ADN, I'd like to do that. But if it's not applicable, I completely understand.
Well, go ahead, Susan, I'm sorry.
Unfortunately, it is not. But once you obtain that ADN, there are several BSN programs that are kind of accelerated BSN programs. Such as Western Governors University, which is another great school. You can go ahead and get that BSN really quickly and then apply.
Okay, so then would my experience in the birth field for the last 20 years, would that count as, like, I know you guys need that 1 year before I could apply.
Okay.
Well, go ahead, Susan.
It's kind of a sticky situation because it's evaluated on a case-by-case basis. And so what you would have to do is write an essay, and that would have to go to the admissions committee and where they would ultimately make that decision.
Okay.
But generally they're looking for that 12 months of basic nursing experience.
Okay, thank you.
Okay, Selena has a question. As a remote student, does the program help me find a preceptor, or do I pursue that on my own? So you definitely will not be doing it all on your own. Carissa is one that would be great to address that. Carissa, do you want to take that one?
Sure, I'd be happy to address that. 2 years ago, we started the Clinical Outreach and Placement Department. Now at Frontier, you are responsible for finding your own site. However, we have people in place now, myself included. I take care of all the midwifery and our women's health students from the Midwest to the East Coast. We have another person just on the West. And what we do is we help you through the process, because it can be daunting trying to find potential preceptors, whether you want it in a birth center, whether you want it in a hospital, whether you would like some home birth activity. But we help guide you. We help talk about networking and marketing and how you can build yourself up to be a great candidate for a potential preceptor, either in your area or another area that you would like to pursue. So yes, there is help and support for that, depending on where you live. We always want to think about, is your area saturated? Do you know potential preceptors in that area? But yes, you would make an appointment with myself or Katie Graves once you started the program, and we will definitely help you through that process. We'd like to have all of your sites lined up 6 months before you come to Clinical Bound. And then you're ready to go. Once you come to Kentucky, you have our stamp of approval for Clinical Bound, then you can go back to your hometown and you can start. But I help you put those pieces together to find out what you want and your perfect clinical rotation, I should say.
So just so that you know, I mean, because I have friends who've done the online, and I actually have friends who are preceptors. I mean, I'm sure it applies to other states as well, but there are like online like service centers where you can look for preceptors within your area, and you can make contracts with those preceptors and pay for the preceptors. So that's a way to make it a little bit easier. And I don't know if it works well with other advanced nursing degrees, but I know a lot of midwives have told me they've utilized it for midwifery, and that was how they got their preceptor. So it makes it a little bit easier.
Yes, and you can do that. We don't endorse or not endorse doing that, paying for a preceptor. You do pay for tuition, and I am part of your package. So if you would like that, we are here to help you. We have our community map too, and that is over 10,000 potential preceptors and sites that we have that we can utilize to help you try to find something. And that is only if you're a Frontier student that I can utilize to try to help you find something in your area. So yes, you can potentially hire someone, but like I said, it's a package deal here. So you will be assigned a clinical advisor, but if not, that's fine too. You can use that service as well.
Okay, Susan, I think I have another one for you. Does Frontier take CNM students who are transferring from another program?
We do take transfer students. However, we only take a maximum of 12 transfer credits. So anything more than that, you would not be able to transfer. That, institution also needs to be accredited, but transfers are not decided in the admissions office. What happens is you apply, and if accepted into the program, that is when you would then transfer your courses, because we don't do like a school to school transfer. We still work from your highest degree earned.
Okay, thank you, Susan. Nicole Young says, as someone who practices as a nurse practitioner and has years of L&D experience, what would a track look like for a postmaster certificate? Nicole, that would probably be about a year to a year and a half commitment.
Mm-hmm.
You would meet with us and we'd kind of go over that. I don't know, Susan or do you want to speak to that a little bit too?
The 3 Ps are required as a prerequisite for that. So that would be the PGC program. So you would already need to have your advanced pharm, your advanced patho, and your advanced physical assessment to do that program.
And if you have those, your didactic portion lasts exactly 1 year. And then that's when you can start clinicals, and that's when you'll need your 540 hours. It's a little less if you're coming back for your PGC than if you are here for your MSN, which is 675. So you're definitely on a faster track because you have a lot less courses to take. So you can predict about a year and a half, year and 9 months. for your PGC certificate.
Okay, thank you. Next question, as someone who will be starting a BSN program in the spring, should I be reaching out for FNU admission guidance while I am in nursing school, or should I start talking to an advisor closer to when I start my first year of RN practice?
That would be once that you start working as a nurse and have at least 4 to 6 months under your belt before you would apply. We do work 6 months in advance. So, you know, it just has to be 12 months by the start date of the term.
All right, Carissa, can you speak more on the process of connecting with preceptors who are local in our community once we are FNU students? Is there a way to contact FNU grads or preceptors to learn more of their experiences before deciding to apply to the FNU program?
Absolutely. We have our community map, like I'd spoken on before, and that is accessible to you as soon as you become a student. And I usually go through and we can run lists of potential sites in your area, potential preceptors in your area, and other Frontier students and alumni. So once you are a Frontier student, yes, you will have access to that. And I've been here quite some time. So if I have a former student that's out in the community practicing, a lot of times I will connect those two. But as far as before deciding to apply to the program, I really can't give you that information because of FERPA guidelines and things like that. But I would encourage you to become a local member of the local ACNM and also start networking, finding conferences. You are going to find lots of FNU grads around your community and things like that. Also, I would read some biographies online. LinkedIn is a good resource too. We tell all of our students, and I have been for years, to go ahead and get a LinkedIn profile. You can go on there and you can see who is a Frontier alumni through LinkedIn because it's a public forum. So those are some ideas to try to talk to a Frontier grad to see what their experiences are. And there's also a Facebook page called Frontier Hopefuls, Frontier Facebook Hopefuls. So I know they talk about those things there as well. So feel free to reach out to any of those things, look for biographies that say Frontier graduates, and just start talking in your community and you'll find this.
All right, thank you. So what is the minimum part-time track a student can pursue at Frontier for their CNM? So that is really designed, that part-time track is designed to do 2 courses at the time. And so that's basically 6 credit hours at the time. And using that program of study, it's designed to last 3 years from start to finish.
Eileen, if I could jump in here, another good part about that is being a former academic advisor. If there's ever a time where you need to drop down to 1 course at a time, say it's summertime and you have if you have kids running around, if you need to drop down to 1 every now and then, that's totally fine. We know life happens. And then if you wanted to make that extra course up somewhere, you could take 3 at another term. And that's why your academic advisor is there to help you along the way, because we know life happens. It is not lockstep program. So we can mix it up a little bit if you need to.
Thank you, Carissa. Next question, what is the process of clinical placement with a preceptor? I've heard stories about students having a hard time finding a preceptor due to other midwifery programs, including placement in their programs. Carissa, that one's all you.
I guess that would be me again. Once you are enrolled, we had students just start this week, a brand new term, and I've seen many students already. I work with you one-on-one using the community map, talking about how to market yourself. We have specific tools that we like you to use. You don't have to use, but we will definitely help you through this process. And once you do secure a preceptor, because we want you to do that early on in your program, and we want you to maintain that relationship, because it may be a year, it may be 18 months before you get to do your clinicals. So we want you to maintain that relationship, and we give you tips and tricks and ideas on how to do that. And I definitely, once someone wants our services, I definitely keep up with you once per term to make sure all your sites are lined up, you've submitted the right paperwork, and you keep that relationship up with that potential preceptor. So we have our whole department designed to help you.
All right, Cindy wants to know if I am already a women's health nurse practitioner, does that shorten my journey to CNM at all? It definitely does, Cindy. As Susan mentioned earlier, you want to take that one?
That would be considered our PGC program, and that is a 16-month, well, no, not for CNM, it's a 22-month program. And, you know, again, the 3 Ps are going to be requirements for that program. So if you don't already have those would have to be added, lengthening the time, you know, but again, you're only going to do 540 clinical hours.
All right, Allison asks, can you split your preceptor experience between home birth and hospital? Yes, absolutely. We really support community birth. We love students to have experiences at both home birth and clinic birth center sites. And then the other question is also, does 1 year as an RN birthing assistant for a home birth count? And is it absolutely necessary to have a full year of experience before applying? So let me get that question in. Yes, an RN and as a birthing assistant for home birth does count. The full year needs to be accomplished before you begin the program, not before you apply.
Mm-hmm.
And as you can see, the application process is fairly lengthy, so you can begin the process while you're working towards that 1 year of experience. Let's see, she says, I am currently applying to an accelerated BSN program next summer, which takes 12 months, and then we'll be looking to apply ASAP to Frontier. Okay, and I don't know if, Allison, if you're already an RN working. If so, then as soon as—
No, so it's an interesting story. I'm doing a complete career change. I currently have a bachelor's degree in business and an MBA, and I have decided that's not for me.
Okay.
So I'm completely switching and starting from the ground up, but because I have a bachelor's, I'm able to do that accelerated program.
Right.
So
Right.
that is a benefit. I just wanted to make sure that I am, like I know some other people have mentioned, just cutting off as much time as possible and making sure that I take advantage of everything. So just wanted to make sure that, you know, there wasn't anything else I could do in order to start early, but I think I've got the clarification I need.
Okay, great.
Thank you very much.
Okay. Thank you, Allison. And that's it. Let me please know that that's a common story that we hear. Second career, third career. We're all still trying to decide what we want to be when we grow up. Okay, so the next question is, as adult learners, have your previous students found it difficult to continue working while in your postmaster's program, especially once beginning clinical? So this is a really good question, Nicole. In an ideal world, you would not work while you're in school, and that would be lovely and beautiful, but we know that's not a reality for many of our students. I mean, we really do want you to have a place to live and the basic necessities of life. So I would say the majority of our students have to work to some extent. It can be challenging once you get to the clinical part of the program to work full time. People do a lot of different creative things to work that out, saving up vacation time so that they can cut back a little bit or whatnot. Keep in mind that at the very end of the program, there is a length of time where you're required to be in the clinical site for 30 hours a week. So it can be hard, if not impossible, to combine that with a 40-hour-a-week job. So I think it really does take some consideration of how you're going to be able to manage your time, give those courses the amount of time that they need. Which kind of segues into the next question, which is how much time commitment is recommended per week for coursework? Anybody have that? Susan, do you have that number?
That's going to depend on the individual and how many courses they take each term. So, you know, think about it. If you're taking 2 courses that term, you're going to say about 20 to 30 hours on coursework. And then the same if you're doing 3 courses, you're going to say about 30 to 40 hours on coursework.
And so a lot of people just, you know, it's a lot to balance with a full-time job. I will say that. It's ideal, I think, if you have some way to make some accommodations, but people make it work. It's really quite amazing to me. So, all right, next question. Do preceptors have to be only CNMs or may it be MDs? So we do allow physician preceptors, but physician preceptors are limited to 20% of the hours that you spend in the clinic and 20% of any particular visit type, 20 to 30% of any particular visit type. And the point being that we really believe that advanced practice nurses and nurse midwives bring something different to the table than physicians do, complementary to physicians, but not the same. And we really want you to learn that from other advanced practice nurses and other nurse midwives. All right, Kimberly's question, would a solid year of L&D nursing as an ADN RN count, or does the year have to be after you obtain your BSN? It does not have to be after you obtain your BSN. So if you've been working as an RN with an associate's degree, and then you're adding the BSN, all the time that you worked as an RN counts. Is there a way to apply for a dual degree for CNM and WHMP? That's a great question to whoever's on the iPhone. Yes, well, we don't really call it a dual degree. What you would do, what I would recommend doing is apply for the CNM program, complete that, and then we have a WHMP completion program that really only adds 1 term or 3 months to your program of study, and you have both at the end. So while it's not a dual degree, other universities have what they really refer to as a dual degree. Ours is that women's health completion program that can be done in one extra term, which is 3 extra months. Allison's question is, what if you work where you do clinicals? Is that allowed? The short answer to that question is no. You cannot work on a unit where you would sometimes be working as an RN and other times being working as a student nurse midwife or student nurse practitioner. There are ways to work around that. Students will take a leave of absence, or they will transfer to another branch of the institution, another unit. You can't be in one physical unit for both roles. And this is the wonderful thing about the regional clinical faculty that you would be assigned to work with. They would be specific to the area that you live, and it's really amazing how much they know about your sites, and so they can oftentimes really help guide you. Those clinical faculty are always midwives and or nurse practitioners, but they can help guide you with ways to figure out how to stay employed and keep working, but also do your clinicals, because you cannot do them at the very same site. So the next question is about CPMs. That certified professional midwives are not eligible preceptors. It would have to be a certified nurse midwife, or in a few states, a certified midwife, but the point is they have to have taken boards through the American Midwifery Certification Board. So that's CNMs and CMs. CPMs are certified through NARM, and that is a different level of certification. They would not be eligible for to be a preceptor. Cynthia's question is about how many preceptors do we need? You can actually graduate with only 1, but most of our students have more than 1, and most practices have multiple providers, and we really encourage you to get more than 1 credentialed if at all possible. It just opens your opportunities for working and experiences up to have more than 1 preceptor. So I would say typically the typical number is probably 3 or 4, something like that, although it can be done with just 1. And some people have quite a few more, 5 or 6. All right, maybe I got to the end of the questions. Does it, Susan or Carissa, did you see anything that I missed?
I think you got them all.
No.
Could
You're
I
welcome.
ask a question as well?
Certainly, please do.
I was wondering, I know you mentioned, sorry.
That's okay.
Man. You had mentioned that you could get the WHNP after your CNM, and I was just wondering what skill set does that provide you that the CNM does not?
Well, the women's health nurse practitioner has a stronger emphasis on primary care. So you would have a little bit, you would definitely spend more time in the clinic doing those primary care type visits, and also more emphasis on specifically on women's health. But another part of the answer to your question really comes down to where you live. Different state nurse practice acts and legislation in different states will sometimes make it easier to make you more employable in one role versus the other. And the way I look at it is, regardless of where we all think life is going to take us, you never know. And just because you may be in a state when you finish where midwifery is really the easier way to get a job, down the road, you never know, you might find yourself in a state where you find a job easier as a women's health nurse practitioner. I will just say, I mean, I've been a midwife for 30 years. I could have started with that. I could have led with that and let you know that. Sorry about that. I will say at this point, if I'd had the option when I was doing my midwifery to have added the women's health in one term, and I had ended up doing so, I would have been very happy for that opportunity, and have thought about doing it now. But as Susan mentioned, those 3 Ps, I didn't take the 3 Ps as separate courses. And I'm not going back that far at this point. So I think it's a fabulous opportunity to take advantage of. And a lot of our graduates end up going on to add the women's health nurse practitioner. I think it just really, it gives you a little extra knowledge, but it certainly, I think, expands your employability and your opportunities, I think. So something really to think about.
Making you more marketable.
Yeah, and which is important. So.
And as you get up there in age, you might not want to deliver babies 24/7. So that's always
And be on
plus.
call.
That's
That
right.
might be what I'm thinking about at this point in my life, if I'm being fully honest with you. Okay, any other questions?
Yeah, just to clarify, did you say that the women's health nurse practitioner route, in addition to after you complete the CNM, is an additional term or 3 courses? Was that
It's
correct?
one term. There are no additional academic courses. It's more clinical hours that are more focused on those primary care and women's health visits. So it can be done in 3 months.
Wow. Okay.
It's an additional 180 clinical hours.
Okay, that makes sense. Thank you.
Okay, I have one more question.
Okay,
I have a
sure.
good friend of mine. I have a good friend of mine that's a CNM in my community, and she's told me, once you get your ADN, you can come and work with me, and I'll take you to births and stuff, so I can start gaining experience with the CNM. How much? I know it's a year, but is there like so many hours that I need within that year?
Nope, just a year's time, Susan, is that
You
right?
need to be a licensed registered nurse for 12 months before the start of coursework.
Right. Yep. Okay. So once I have my ADN, I could work with her for a year.
Well, as a nurse,
Right.
I mean, would you be working with her as a nurse, or would it be kind of in a voluntary role?
Working with her as like her birth assistant that she takes to deliveries and all of that. Doing
Yeah, that would
prenatal
count.
visits.
That you would need to be a registered nurse for that. So that as
Right.
an ADN, and then you'd have to get the BSN somewhere along, unless you know you already have a handful.
No. Yes, I have a lot of experience, but I'm in nursing school right now.
Okay,
So
okay,
yeah, I have a
okay.
lot of experience.
That
as a
makes sense.
CPM, but yeah.
Yeah.
Okay. All right. So there's not like a set amount of, like, if I'm working with her, a couple days a month or a couple days a week, and it's not full time, that would still count like for a year if I was with her for 1 calendar year.
Yes, I believe so. I don't think there's not a limit on like, you've got to be working 40 hours a week.
Okay.
In the guidelines, it just says 12 months of nursing experience. So
Okay.
what they're looking for is that basic bedside nursing.
Got it. Okay. Thank you.
Okay,
I have a question in regards to if you already have like your if you already have your WHNP, is it a shorter track to become a nurse midwife, like as already being an advanced nurse practitioner and being in women's health? Like, what does that look like?
Well, you would still be required, that would be our PGC program. You'd still be required to have those 3 Ps we talked about, the advanced pharm, the advanced patho, and the advanced physical or health assessment across the lifespan. So those would be required. Then the program would be 22 months. Now, with that being said, you would also be able to transfer in up to 12 credits that applied. So that would also shorten it. So your case would be a little more individualized than, say, someone else coming in that was a pediatric nurse practitioner wanting to do the PGC. Do you understand what I'm saying? So it's kind of a little different for you. But unfortunately, again, transfer credits are not decided in the admissions office, and those are looked at after you apply and have been accepted.
Okay, thank you.
Okay, and then there's one more question in the chat box about how FNU supports entrepreneurial skills for graduates. In the master's program, we have a course called Principles of Independent Practice, which is really focused specifically on these entrepreneurial skills, things that you need to know to be in practice, to either start your own practice, start a birth center, or even join a practice. They're skills like coding and billing, peer review, quality improvement. It's really, that course is really focused on the business side of things. And then if you go on to get your DNP, which we really encourage people to do, then you have even more leadership courses, health policy and ethics courses. So I do think that we really do offer, in my experience, more than most other midwifery programs along those lines, because we have a really strong value for that.
Another thing, Dr. Thrower, is we do require that all students midwifery track do the How to Start a Birth Center workshop through the accredited body of the CABC. So that is something that students absolutely love. They are consistently pretty much all across the United States, and you can do them also virtually if you can't travel. And that really hones in on entrepreneurial skills as well, and actually starting your own birth center. And I actually have a former student that's opening one now, and it's just a beautiful thing to see her coming from our bridge program, which is no longer bridge to ADN. Then she got her DNP and now is opening her own birth center. So there are definitely some follow-ups with our program.
Susan, can you address Natalie's question?
Yes.
Okay, do you see it?
Yes. The acceptance rate currently is about 53%. And the thing that I like to tell my applicants is that you want your application to be a reflection of you. You want your resume to reflect the kind of nurse you are, and the experience that you've had. You want to pick professional references that can attest to your skills as a nurse. And then you'll also want to focus on your essays. They really take those into consideration, and they look at those really closely. And you want all of your application material to reflect who you are. So I always tell my applicants that when you do your essays, imagine that you're sitting across from the admissions committee and they're asking you these questions. They like to see a little bit of heart in each one of those. So they're not looking for a standard, please, can I get into your school type essay. And I think that's what makes it so unique at Frontier, is because they look at you as an individual and what you've done as a nurse. And, you know, I love that holistic way of, you know, the admissions process.
So Kimberly is asking, were we the only ADN CNM bridge program in the US, and any chance that that's going to come back? I'm not sure if we're the only one. I can give you a little bit of the rationale for why that bridge program doesn't exist any longer. And it's really twofold. One, there was no, we don't really assign the BSN. So that could be really hard for students if they came to the bridge program and weren't able to finish the entire MSN program. They never got, we're not able to confer the BSN. And there are so many accelerated BSN programs in the country now that we felt like we were spending a lot of time and energy on something that you can get a lot in a lot of places, and you can, and you know, then you're going to end up with that BSN, which I think it does offer some advantages to have that BSN. So that's kind of the reason that we decided to put our energy and focus our efforts in other areas to really support students once they've got that BSN. I don't know, Susan, if you want to add anything to that, or.
I have a question for BSNs. Do they expire? Like, I graduated from BSN program 16 years ago. Are there courses that need to be refreshed before applying?
Nope, you are perfectly fine there.
As long as you've had a basic physical or health assessment that is a standalone course that is at least 3 credits, that may be the only thing that if you did not have in your BSN program that you might have to retake.
Oh, no, we haven't. Okay, great. Thank you.
You're welcome.
Do you find it hard for students to transition from learning that long ago to, I've had such a fear about joining the online learning community that I've been hesitant to go for it, so to speak, from learning in the classroom to learning online? Is there a huge learning curve?
You know, I think it's just a different learning curve than the next person, perhaps. I'm going to tell you personally, for me, I became a midwife in 1990, and then in 2013 decided to go back and pursue a doctoral program. And I was terrified. Even after I was accepted, I experienced what I now know is called imposter syndrome, because all I could think of was, wow, somehow I pulled the wool over their eyes. They don't know that I haven't written a complete sentence in almost 25 years, because all I do is bullet points when I chart, you know, as a nurse or as a midwife. But we see this every day, that students apply that have it runs the whole gamut. Some have come straight through as fast as they can, but that's really not typical. Most of our students have been out for a while, and some of them for a long while, some of them almost as long as me, going back to school 20 plus years. And it's a little bit different, but it's really manageable and really doable. So don't let that be too frightening to you. We have a lot of support here to help you with that too, and figuring out how to function, you know, in an online program with the different software programs, so platforms that we use. There'll be a lot of resources for that. So you can do it. Don't be too terrified by that one. It's yeah. I think that's a very normal feeling to be experiencing. If you weren't feeling it, I'd be a little concerned as to why not, honestly.
Fair enough. Thank you so much for sharing.
You're welcome.
I must say our IT department is wonderful. You can call them almost 24/7. We have really, really good IT hours, and they help students through the simplest things, such as I can't get my screen to stop flickering. Anything they will help you with, not necessarily school related, to get you to where you need to be. So I just want to put a plug in for them. I met a student just earlier this week, 56 years old, coming back to school, and she didn't know how to get on a Google Hangout, but we walked through it before we started anything. So we are definitely here to enable you to get where you need to be and meet you where you are. We've seen it all. I think Dr. Thrower, don't you and Susan? We truly have. So don't be afraid. If you just take that leap of faith with us, I think you'll be happy. But
if someone has a PNP, but they've never worked in it, are they still eligible for the postmaster certificate program?
Yes.
Okay.
Yes, as long as you have that master's degree, you are still eligible for the postgraduate certificate. Susan, I think there's one more question in the chat box for you.
Right. So what happens when you apply online? You're going to fill out the online application, and then a link is sent to you so that you can upload your documents. What's going to happen is you're going to go in, create an account, and you're going to fill in some information there as well. What you're going to do is you're going to give 3 email addresses for your professional references. Now, as soon as you submit that in that portion of the application, those are going to automatically be sent to them. Now, they're going to look like junk or spam, and they're going to come from a do not reply email. So you have to let them know that, and they may be in their junk or trash. And then what happens is they open it up, and it's a questionnaire, again, to attest to your skills as a nurse, and they're going to fill that out. And as soon as they hit submit, then it automatically kicks right back into your application. So that part is done. And it gives a little green check mark so that you can see who's filled that out and who you need to say, hey, excuse me. You remember I sent you that little thing?
All right. Well, thank you all for coming this evening. It was really nice to be able to answer your questions, and we look forward to maybe hearing from you soon.